Nursing care delivery, delegation. The learning outcomes for this presentation are to explain the authorising mechanisms and order, direct order, directive and delegation, to discuss the difference between delegation and orders, to describe the responsibility and accountability of the RPN when delegating and accepting delegation, and to reflect on the role and responsibility of the RPN when teaching. Scenarios to consider. The registered practical nurse teaches and delegates suctioning of a client who had a permanent tracheotomy 2 years ago to an unregulated care provider. The practical nursing student wonders whether oral medication administration is a controlled act. A 67-year-old diabetic living at home hires an unregulated care provider to give her regular daily insulin injection. The practical nursing student who is unregulated can cleanse and dress an open surgical wound even though this is a controlled act. The registered practical nurse questions if wound debridement is within the RPN scope of practice. The new graduate RPN questions why an RN can start an IV without a doctor's order and whether the RPN can do the same thing. A registered practical nurse wonders whether cast application is a controlled act and if it is authorised to nursing. The CNO has a number of resources: decisions about procedures and authority, working with unregulated care providers, the RN and RPN practice environment, directives and authorising mechanisms. Please review these. Part of the role of the nurse is to assign and delegate care. This is a necessary skill that allows nurses to be able to complete necessary duties and responsibilities. Nurses unable to appropriately assign or delegate may find themselves stressed, frustrated, and unable to adequately provide safe, effective patient care. Many new nursing graduates find themselves overwhelmed by the large number of duties and tasks they are required to complete in a shift. The purpose of assigning and delegating is to allow activities and tasks to get done in the most efficient and effective way. Student nurses, however, rarely get to experience assigning and delegating, although they may understand the theory. This is typically one of the new skills that they will learn on entry to practice. Making decisions about procedures and authority is a complex issue. The CNO has set out 4 standards with indicators which describe the responsibility and accountability of nurses when performing any procedure. These include whether choosing to delegate procedures. The standards with indicators include appropriate healthcare provider, authority, competence, and managing outcomes. It's important to have a look at the indicators for each of these when making decisions about procedures and authority. Please review this document, the RN and RPN practice, or watch the webcast on the CNO website to refresh your understanding of the scope and role of the RN and RPN. The Authority to Perform Procedures table outlines the authority to perform procedures as set out under the Regulated Health Professions Act. Nurses have a broad authority to delegate and accept delegation in order to promote client safely and timely access to care. The College of Nurses of Ontario does not provide a list of activities appropriate for nurses to delegate. Both RNs and RPNs have the authority to delegate. So what is delegation? Delegation is the formal transfer of authority of a controlled act from a person who has the legal authority under the Regulated Health Professions Act to a person who does not. For example, a nurse may delegate suctioning of a stable home care client with a permanent tracheostomy to a non-regulated care provider. Nurses delegate controlled acts to those who do not have the legal authority to perform them. Delegates may include family members, personal support workers, or other nurses. Caution: nurses in the temporary class cannot delegate or accept delegation. Nurses can delegate and accept delegation if they are in the general class. Important note: a nurse may need additional preparation in order to be able to delegate or accept delegation completely. That is, they might need to enhance their knowledge, their skill and/or experience. Nurses may only delegate those acts under the Regulated Health Professions Act that they have the authority to perform. RNs may delegate to other RNs, to RPNs, or to unregulated care providers. RPNs may delegate to unregulated care providers. Nurses may not sub-delegate any procedure that has been delegated to them. For example, a nurse working in an immunology clinic has been delegated the procedure of allergy challenge testing by the doctor in charge of the clinic. This nurse cannot legally sub-delegate this procedure to another nurse. A nurse may not delegate if delegating will breach a standard of practice for nurses, if the person the nurse wishes to delegate to is not adequately trained or competent to perform the procedure or activity, and if delegation contravenes a provision of the Nursing Act or Regulated Health Professions Act. Also, a nurse may not accept delegation under the above provisions, and if the nurse accepting delegation is not competent, that is, has the knowledge, skill and experience to function without supervision. There are 10 requirements for delegation. Please review authorizing mechanisms where these are. Requirement 1. The nurse has the authority under the Regulated Health Professions Act to perform the controlled act. 2. The nurse has the knowledge, skill and judgment to perform the controlled act safely and ethically. 3. The nurse has a nurse-client relationship with the client for whom the controlled act will be performed. 4. The nurse has considered whether the delegation of the controlled act is appropriate, keeping in mind the best interests and needs of the client. 5. The nurse takes reasonable steps to ensure that he or she is satisfied that sufficient safeguards and resources are available to the delegatee so that the controlled act may be performed safely and ethically. 6. The nurse has considered whether the delegation should be subject to any conditions to ensure that it is performed safely and ethically, and has made the delegation subject to conditions if applicable. 7. After taking reasonable steps, the nurse is satisfied that the delegatee is a person who is permitted to accept delegation and is a nurse who has a nurse-client relationship with the client, or is a healthcare provider who has a professional relationship with the client, or is a person in the client's household, or is a person who routinely provides assistance or treatment to the client. 8. When the delegatee is a nurse or another regulated health professional, the nurse must be satisfied that the delegatee has the knowledge, skill and judgment to perform the controlled act safely and ethically. When the delegatee is not a regulated healthcare professional, the nurse must be satisfied that the delegatee has the knowledge, skill and judgment to perform the controlled act safely and ethically, and that the delegation is appropriate for the client. 9. If the nurse has delegated a controlled act, but has reasonable grounds to believe that the delegatee is no longer able to perform the controlled act safely and ethically, the nurse must immediately cease to delegate the controlled act to the delegatee. 10. The delegating nurse shall ensure that a written record of the particulars of the delegation is available in place where the controlled act is performed before it is performed, or ensure that a written record of the particulars of the delegation, a copy of the record, is placed in the client record at the time of the delegation takes place or within a reasonable period of time afterwards, or records particulars of the delegation in the client record either at the time the delegation takes place or within a reasonable period of time afterwards. There are 7 requirements for accepting delegation. These are for nurses who accept delegation of a controlled act not authorised to them. Please review authorising mechanisms for specific details. Requirement 1. The nurse has the knowledge, skill and judgment to perform the controlled act safely and ethically. 2. The nurse has a nurse-client relationship with the client for whom the controlled act is to be performed. 3. The nurse has considered whether performing the controlled act is appropriate, keeping in mind the best interests and needs of the client. 4. After taking reasonable steps, the nurse is satisfied that there are sufficient safeguards and resources available to ensure that the controlled act can be performed safely and ethically. 5. The nurse has no reason to believe that the delegator is not permitted to delegate the controlled act. And 6. If the delegation is subject to any conditions, the nurse has ensured that those conditions have been met. 7. Nurses who perform a controlled act that was delegated to them must record the particulars of the delegation in the client record unless a written record of the particulars of delegation is available in a place where the controlled act is to be performed, a written record of the particulars of the delegation or a copy of the record is in the client record, or the particulars of the delegation have already been recorded in the client record. There are a number of expectations for nurses working with unregulated care providers. It is important to carefully look over these. Now is the time to check your knowledge. The next few questions are going to assess what you have learned from this video. Question: which controlled act does suctioning a tracheostomy fall under? Question: can a nurse delegate the controlled act of dispensing a drug? The third controlled act authorized to nursing is putting an instrument into an artificial opening of the body. Although one of the controlled act authorized to nursing, nurses may not delegate the procedure of dispensing a drug. A doctor may delegate casting a fracture of a bone to an RN or RPN. Why does casting a fracture require delegation in order for a nurse to perform this procedure? Setting or casting a fracture of a bone or dislocation of a joint is not one of the 4 controlled acts authorized to nursing under the Regulated Health Professions Act. Bill, a practical nurse, has taken a course on managing and casting fractures. Bill's employer has developed specific policies and procedures related to the scope of practice for RPNs, and Bill has consistently demonstrated knowledge, judgment, and skill. His work colleague is an experienced nurse practitioner. Mr. Zan is Brian's patient today. The nurse practitioner has delegated the application of a cast to Mr. Zan's left forearm to Brian. Bill is supervising a newly hired nurse. Can Bill delegate this task to the nurse? No. To delegate this task would be sub-delegation, which is not legally allowed. Can medication administration be delegated to an unregulated care provider? Can sliding scale insulin be delegated? Can suctioning be delegated? Medication administration may be delegated with conditions. Sliding scale insulin may not be delegated, as this requires nursing assessment. Suctioning may be delegated to an unregulated care provider if it is consistent with an activity of daily living. A personal support worker at a retirement facility has been taught urethral catheterization. She has passed the course and has her certification. The RPN in charge of the unit knows that this PSW can, please choose which is the correct answer. A. Do the intermittent catheterization on any client in the unit. Only do intermittent urethral catheterization on the PSW's regularly assigned clients. Only do intermittent urethral catheterization on one specific client when this procedure has been delegated, or never do catheterization as this is a nursing skill only. The correct answer is C. Please match the following terms and example: direct order, directive, initiation, delegation, supervising, and teaching.